We've gathered here today to talk about an issue that is very important to our members and to communities nationwide. The recent reports about cases of Ebola virus disease being contracted by nurses in the U.S. has many Americans concerned about our readiness for an outbreak of the virus in our healthcare facilities and also in our communities. We've brought together our president, Randi Weingarten, and some of our nurse leaders to discuss reasons they believe this issue is important to address now, as well as imperatives for ensuring that our healthcare system is equipped to deliver care for Ebola patients in a way that is safe for those patients, but also is safe for the professionals who deliver care to them.
Standing behind me are several of our activists from around the country who have been working for the last several weeks on the plan that we are going to talk about today. And I just want to say thank you to all of them, this union of professionals, these activists and leaders throughout the country who put community and patient health first in everything that they do as a union and as practitioners, as nurses, and as healthcare professionals. So I just want to say, first and foremost, thank you for all the work that you have done. We are the second largest nurse union in the United States of America, and we are taking action on a global, national, and community basis to address and contain the Ebola crisis, not only in West Africa, but here in the United States of America. While we work to contain the Ebola crisis in the United States, let's be clear that West Africa's Ebola crisis, their Ebola outbreak, is one of the deadliest challenges of modern times, and we must be vigilant in supporting the efforts to solve this crisis globally, not simply in the United States of America. The AFT is committed to working with NGOs and others to respond. We've directed funds from our Disaster Relief Fund to support our international affiliate, PSI, in their building and advocacy of a long-term public health infrastructure. We've also directed funds to Partners in Health and Doctors Without Borders. Here in the United States, nurses and health professionals are the front lines of this as well as any other health crisis. And our number one priority is keeping our communities safe and healthy. And with the right training, planning, and equipment, we can contain the Ebola virus in the United States. We are proposing a 3-point plan. Number one, infection control protocols and worker preparedness are needed in all health facilities. Number two, we think that these dedicated facilities are a good idea. We think that they should be in every state as well. But there needs to be dedicated teams of willing staff to be trained to care for patients suspected of having Ebola. Identified teams must be inclusive, including doctors, nurses, and lab, x-ray, and housekeeping. And there needs to be adequate staffing. And number three, frontline providers who are key to containing Ebola must have a voice and be involved in the development and implementation of plans. Implement, educate, practice. We at the AFT have prepared lots of materials on how to do a lot of what I just talked about. But the best materials, the materials that people should look at, are the materials on the CDC website. But we also have materials on our website, aft.org, for nurses and health professionals to address this crisis, and we're also preparing materials for schools to address this crisis. This should be a wake-up call to make public health care investment a priority in the United States of America. We've had years of cuts and cuts and cuts, leaving many states without the public health infrastructure necessary to provide the education and the services on a wide range of healthcare issues, including this one. And frankly, partisan politics have left us without a Surgeon General, and that has to change too. Why do I say that about the cuts? Think about it. Funding for U.S. Hospital Preparedness Program, which helps communities and hospitals prepare for public health emergencies. It's been cut 50% since 2003. The CDC itself reports that it's lost nearly $1 billion in funding due to sequestration and cuts. So, bottom line is, we are on a precipice of a panic. This is a life-threatening disease, but it is eminently containable, but only if we include nurses and frontline care providers in the development and implementation of Ebola response plans, and if we do and adopt this 3-point plan.
I work in an intensive care unit in a small town in Oregon. My coworkers, our members, are out as we speak, getting prepared, asking for, and in most cases, getting the equipment they need. We do need those clear CDC guidelines so that we can perform our jobs in a safe way. We know how to take care of patients. We need the additional training. We need that equipment to be universally available so that we can be ready to address any of the Ebola victims that may come our way. Our members are solution-driven. We're trying to work cooperatively with our management so that we will be able to be prepared and provide those services to the patient and keep our members safe.
As you know, AFT is the second largest union representing nurses throughout the country. We are the largest healthcare union in New Jersey. There is a great importance to have some uniform, clear, concise protocols and procedures in place, not just for the nurses, not just for the doctors, but for everyone. So when we call for teams, identifiable teams of individuals who will be trained, who are committed to work with patients who are suspected of having Ebola, we think that's a key fundamental requirement. It is not just the nurses, it's not just the doctors, it's the housekeepers. What do you do with the linen? Okay, it is the lab, they get the blood. And so everyone needs to be trained, and the people who handle from the time a patient enters to the time a patient leaves healthy, it should be that team that takes care of the patients. But this also calls for people to be in charge. We think that people should be in charge on the state level and the county level and in the hospital level. It shouldn't just be, what do we do if we're presented with someone? It should be clear what happens. And let me also say, the clerical staff who takes the patient in, asks the questions, okay? They're key. We don't want people sitting in the waiting room. You know, these are additional responsibilities. We have to have quick identification. We have to have quick treatment. We have to have the proper people. And therefore, it means proper training, proper staffing, proper protocols, and somebody in charge. So that's what we're calling for on all levels.
I represent our union on a global organization called Public Services International. And I want to stress the fact, well, we have 20 million members nationwide, and we have in our global union members in these affected countries. If we're going to solve this outbreak here at home, we must put our attention on Africa. We knew that there was a crisis in Africa, but we didn't do enough. The world didn't do enough, because that was over there and not here. Well, you know, this is a global society, and, you know, we are everywhere now. And so it is critical that we do not, at this time where we're working very hard to make sure our systems are safe and we have the right protections, information, and so on, that we must also pay great attention to making sure that there's adequate funding sent to Africa. We're doing our part. We're sending money from AFT, but we're also calling on more from our governments, including other governments around the world. But I think we should be concerned that this particular epidemic and this outbreak has seen less response from the public to donate than most of the other recent problems that are in the globe. Our citizens also must step up. As individuals, we must step up and make contributions to help the outbreak and the true crisis, which is in Africa. And we would be, of course, remiss if we didn't call attention to the inadequacy of funding in our own systems, in our own public health systems. I represent public health workers, as many of our leaders here do, and for years we have seen their numbers cut, their budgets shrinking, as we undervalue the role of the public health departments in our states. It is the public health nurses and the public health staff that follow up on all of the contagious diseases, whether it's TB or Ebola. And we all need to know that there's adequate funding. So we need to call upon Congress to make sure that they are adequately funding the public health system, but that also our states and our locals understand the true importance, not just of the hospital care, but of our public health system. We have sat for a year here without a Surgeon General appointed, completely because of politics and gridlock. And you know, there are a lot of things that happen because of gridlock in Washington and a lot of negative consequences. But in this case, we're talking about our health at risk. And so let's get Congress to do the right thing and appoint our Surgeon General.
So can you just tell me, with the situation in Texas and the nurses who were infected there, do you think that they were in any way treated unfairly? Did they get into a situation that was unfair for them? Or do you think that things were done wrong there that you need to look out for your members?
One of the reasons we are focused on a three-part plan of having infection control protocols and specially trained and willing teams is so what happened in Texas, in Dallas, doesn't happen anywhere else. They trusted the hospital to do the right things. And if you don't have these kind of protocols in place that people throughout a hospital, a healthcare facility know, nurses around the country are very effective and wonderful people. They want to do the right thing. The nurse who went to Cleveland, for example, kept calling the CDC to say, could she fly? So this is one of the reasons why funding is so important, but this whole notion of implement, educate, and practice is also important so that people know what the proper protocols are and they implement it with fidelity throughout.
Could you touch a little bit specifically on what you think hospitals around the country can learn from the situation in Dallas?
One of the reasons why we are proposing a three-part plan that needs to be communicated and coordinated is because this is the right thing to do. And you need to have the infection control protocols and to prepare workers. We also, as Ann said, the notion of having specially trained teams, not just of RNs, but specially trained teams throughout the hospital or healthcare facility who are willing and able to work with patients suspected of Ebola requires funding and training. And then the third is healthcare professionals throughout the country, whether they are represented by our union or elsewhere, when they are involved in the preparation and the planning, then what happens is you have that check and balance and that quality assurance up and down the line. That's what helps in terms of coordination and communication. So what we're saying is do these three things, and frankly, as Candy and Ann and Steve have said, it requires funding. And the funding has been cut, and the funding needs to be restored to be able to do this work.
How are nurses conveying the fact that they're following these three protocols and doing the right thing when they care for something like Ebola when it happens?
I think that what happened in Texas is an example of some of the missteps and an example of what we have to fix. So that clearly when Mr. Duncan came in originally and was turned away, that was a misstep. I mean, that's an understatement. And then the protective gear and clothing and equipment that was given to the nurses didn't protect them. So we have to look at what happened there. So was it the right equipment? Did they have the right training? In terms, there's only 3 cases in the United States. We know where they are. We know, so I don't think that the public should be concerned that there is going to be a national outbreak, because everyone is focusing on how to put the right protocols, procedures in place, and that's what we're pushing for too. And we believe that if these things are done uniformly with the commitment of all the hospitals and all the healthcare systems, state by state and across the country, and including the CDC, this will be contained. So I do believe the public can feel confident. And I know that with more and more information, they will be less and less anxious.
It sounds like you're emphasizing that the specially trained professionals who could care for suspected Ebola cases are volunteers. Is that important to you, and what steps are you taking to make sure that staff that don't want to take this risk for themselves don't have to?
The first point is that there has to be infection protocols, control protocols in all facilities. and worker preparedness in all facilities. Because, you know, our nurses and healthcare professionals are frontline first responders. And so we understand our obligations in terms of screening and the like. But what we're talking about is that if you have specially trained and willing providers who want to take care of, and there are lots of healthcare professionals who want to take care of people who may be suspected of Ebola, then what happens is that you then have both efficiency and effectiveness in terms of you don't have to continue doing lots and lots and lots of new training. And so it just is actually a great economy of scale, and it's actually an important humane response. You know, we've talked to our providers and our members. There will be lots of people who step up. Healthcare providers actually step up when there are crises. They run to crises. But we think that asking people to volunteer is important.
You said something very interesting. You said humane response, and my curiosity is, you know, we have a public healthcare system that is private. How does the country convince corporations to take a humane response and still can be concerned about their bottom line? And secondly, is this a wake-up call for us to reconsider our sort of egotistical view that we have the best healthcare system in the world?
I'm not going to get involved in, you know, whether we have or whether we don't have the best healthcare system in the world. What we need to do is make sure that this panic does not become a crisis. We can contain Ebola, and we have a sense of what the steps are to do that. But to your point, you are right. It takes funding, and it takes a public response and a governmental response in terms of public health. But if there are real infection control protocols that are communicated and coordinated, real worker preparedness for healthcare facilities throughout the country, that's a good first step. And the second step, in terms of how to do this work in terms of specially trained teams, is an important step too. But it does require a public response and a public health response. And that's why the CDC and its funding becomes so important. And that's why funding for equipment and for the training becomes important. And that's what we are calling for.